Today's Coffee with Carrie, we're going to talk about the top 5 reasons why hospitals and healthcare companies should be using live video interviews during the hiring process. Number one, as we all know, healthcare has the lowest unemployment rate and it's very competitive in certain markets. It's competitive across the whole U.S., but in certain markets, it's very, very competitive. And using live video interviews will help you stand outside the clutter and build relationships during that interview process. You'll be able to recruit candidates that are working at your competitors by allowing them not to have to take off work to come in for that initial interview and still be able to do that interview whether they're on breaks, lunch, before or after work. Number two, reducing the fill rate. So every recruiter, hiring manager kind of knows in a general sense by role how long it's going to take them to fill that position. Time is money. So being able to fill that position faster. So typically with live video interviews, we see the fill rate being reduced by up to 14 days. In some cases, it can even be reduced greater from that standpoint. The third one is really, healthcare in general hires a lot of temporary staff workers. You have a lot of people that are out on leave. You have to have somebody in that temporary role before you can hire a permanent placement. Whether you're using a recruiting company, a staffing agency, or you're filling that temp position yourself, the ability to reach more candidates, to be able to video interview them and know it right away if they're going to be a fit for your organization will help you get better quality temp staff and fill those temp staff positions faster as well. The next one is candidate experience. So being in a competitive market, you might have an initiative to increase the candidate experience, to increase the hiring process, be more digital, have more digital HR, and reach the younger demographic that is going to be making up 75% of the workforce by 2022. And part of that candidate experience is really developing those relationships during the hiring process, being transparent, being authentic. And 80% of folks who are interviewing during the hiring process, if they develop a deep relationship with the hiring manager or recruiter, will take that job over another one. So the best way to really develop those relationships is starting that day one throughout the hiring process, doing the video interviews. And the last one, number 5, is really about doctors. So most hospitals that we talk to and healthcare providers in general, depending upon their location, they may be hiring doctors that aren't in their local geography. And they're very limited on travel budget on flying those doctors into town. They may be recruiting from med schools. If you could broaden your reach, knowing that you're going to have to reload a candidate, whether it's an ER doctor or any heart doctor, whatever doctor it may be for your practice or for your hospital, if you could broaden your reach, if you could reach more schools, if you could reach more rural towns that people are looking to relocate, or big cities that people are looking to get out of, and do more video interviews and narrow down that hiring funnel to only fly in the top 2 to 3 candidates. But being able to do the video interview really allows you to see the doctor's mannerisms, the bedside manner, to be able to see if they're the type of doctor that is going to fit in culturally and that you're going to want to put in front of patients. So that's the top 5 reasons why you should really be considering live video interviews if you're a hospital, a healthcare provider, if you have a practice, that it's really something that you should be looking at for 2018. That's today's Coffee with Carrie.